Your colon is 5 feet long and processes everything you eat, but most people over 60 ignore the warning signs until it's too late. Colon cancer is the third most common cancer in adults, and 90% of cases occur after age 50. The problem? Early symptoms are so subtle that doctors often hear, "I thought it was just getting older," from patients who waited too long. Today I'm sharing 10 shocking signs your colon is in serious trouble. These aren't the obvious symptoms everyone talks about. These are the silent warning signs that most people dismiss as normal aging, but they could save your life if you recognize them early. The most shocking one? Number 7 will surprise you because 90% of people experience it but never connect it to colon health. Let's start with the 3 signs that demand immediate attention, even though they're often explained away. Sign number 1 is rectal bleeding or blood in your stool. Now I know what you're thinking. That's just hemorrhoids. But here's what most people don't realize. Any bleeding after age 60 needs to be investigated, even if you have hemorrhoids. The blood from colon problems can be bright red, dark red, or so small you can't see it. Sometimes it makes your stool look tarry or black. Don't assume it's hemorrhoids just because you've had them before. Colon polyps, inflammation, and early cancer can all cause bleeding that looks exactly like hemorrhoid bleeding. Sign number 2 is unexplained weight loss without dieting or changing your exercise routine. We're not talking about losing 2 or 3 pounds. If you've lost 10 pounds or more over a few months without trying, your colon might be the culprit. When your colon isn't working properly, your body can't absorb nutrients efficiently. You might also lose your appetite without realizing why. Cancer cells use up energy, which causes weight loss even when you're eating normally. Many people actually feel pleased about unexpected weight loss, but after age 60, unintentional weight loss is never something to celebrate. Sign number 3 is persistent fatigue that doesn't improve with rest. This isn't the tiredness you feel after a busy day or poor sleep. This is the kind of exhaustion that makes simple tasks feel overwhelming, even after a full night's rest. Your colon problems can cause this fatigue in several ways. If there's bleeding you can't see, you might develop iron deficiency anemia, which makes you feel constantly tired. When your colon is inflamed or not absorbing nutrients properly, your body doesn't get the energy it needs from food. Toxins that should be eliminated can build up and make you feel sluggish. Here's why these 3 signs are so dangerous. They develop gradually, so you adapt to feeling worse. You blame aging, stress, or being out of shape. Meanwhile, whatever's happening in your colon is progressing. The earlier you catch colon problems, the better your outcome. Waiting months or years to address these symptoms can mean the difference between a simple treatment and a life-threatening situation. Before we jump to the next point, to keep this channel going, please hit the subscribe button. It truly makes a difference. Thank you. But the next signs are even more deceptive because they mimic problems everyone expects as they age. Sign number 4 is changes in bowel habits that last more than a few weeks. Your normal routine suddenly shifts. Maybe you went from daily bowel movements to every few days, or you're suddenly going 3 times a day when once was normal for you. The consistency changes too, sometimes loose, sometimes hard, sometimes alternating between both. Sudden, lasting changes in your pattern often signal that something is interfering with normal function. Sign number 5 is narrow or pencil-thin stools that persist. Occasionally having a thin stool isn't concerning, but when it becomes your new normal, pay attention. This happens when something is partially blocking your colon, forcing stool to squeeze through a smaller space. It could be inflammation, a large polyp, or a tumor. The scary part is that this change often happens so gradually that you don't notice. You might think you're just not eating enough fiber or drinking enough water, but those changes would affect the firmness of your stool, not necessarily the shape. Sign number 6 is chronic abdominal pain, cramping, or bloating that doesn't respond to typical remedies. This isn't the occasional stomach upset from eating too much or the wrong foods. This is persistent discomfort that antacids, dietary changes, or over-the-counter medications don't help. The pain might be dull and constant, or it might come in waves of cramping. The bloating makes you feel full even when you haven't eaten much, and your clothes feel tight around your waist. These three signs are particularly deceptive because they overlap with common digestive issues like irritable bowel syndrome. The difference is that IBS symptoms usually fluctuate and respond to dietary changes or stress management. Colon problems that need medical attention tend to be more persistent and progressive. They don't get better with the usual home remedies, and they often slowly worsen over time. Your gut instinct that something's not right is usually correct, even when tests for common problems come back normal. Signs 7 to 10. The silent killers. The final signs are the most overlooked, and they're the ones that can quietly progress while you think everything's fine. Sign number 7 is feeling like your bowel doesn't empty completely, even after a bowel movement. You sit on the toilet, have what seems like a normal bowel movement, but you still feel like there's more that needs to come out. You might go back to the bathroom multiple times, or you feel pressure and fullness in your rectum throughout the day. This sensation, called tenesmus, happens when inflammation, polyps, or other problems irritate the lower part of your colon. Your body thinks there's still stool there even when there isn't. Most people just figure they're constipated or not drinking enough water, but this persistent feeling of incomplete evacuation is actually one of the most reliable early warning signs of colon problems. Sign number 8 is the sudden onset of constipation or diarrhea in people who've been regular their entire adult life. If you've had normal, predictable bowel movements for years and suddenly develop chronic constipation that doesn't respond to fiber, fluids, or stool softeners, something has changed in your colon. The same goes for developing persistent diarrhea when that's never been your pattern. This isn't about occasional irregularity from travel, stress, or dietary changes. This is a fundamental shift in how your colon functions. When polyps grow large enough, they can partially obstruct your colon, causing constipation. Inflammation from conditions like colitis can cause persistent diarrhea. Tumors can cause either symptom depending on their location and size. Sign number 9 is iron deficiency anemia without an obvious cause. Your doctor runs blood tests and finds your iron levels are low, but you're not a woman with heavy periods. You don't take medications that cause bleeding, and you eat iron-rich foods. Where's the iron going? Often it's being lost through microscopic bleeding in your colon that's too small to see in your stool. This is called occult bleeding, and it can happen for months or years before you notice any visible blood. You feel tired, weak, and short of breath because your body can't make enough healthy red blood cells without adequate iron. Many doctors will prescribe iron supplements, which might temporarily improve your energy, but if you don't find and fix the source of the bleeding, the anemia will return. Sign number 10 is persistent nausea or vomiting that occurs along with any of the other digestive changes I've mentioned. This isn't food poisoning or a stomach bug that lasts a few days. This is ongoing nausea that makes food unappealing, or occasional vomiting that doesn't seem connected to anything you ate. When your colon isn't functioning properly, it can affect your entire digestive system. Partial blockages can cause nausea and vomiting as your body tries to clear the obstruction. Severe inflammation can trigger nausea as your body's response to the irritation. Here's what makes these final 4 signs so dangerous. They often appear together and reinforce each other. You might have incomplete evacuation that leads to straining, which worsens hemorrhoids, which you then blame for any bleeding. The chronic inflammation that causes the incomplete evacuation can also cause the iron deficiency anemia, but since the bleeding is microscopic, you don't connect the two problems. The nausea might make you eat less, which you think explains your weight loss, but actually, all these symptoms are pointing to the same underlying colon problem. After age 60, your risk for serious colon problems increases significantly every year. The protective mechanisms that kept your colon healthy in your younger years start to weaken. Your immune system doesn't catch abnormal cell growth as quickly. The muscles in your colon wall don't contract as efficiently. Your body doesn't repair minor damage as effectively as it used to. This means that symptoms you might have ignored in your 40s or 50s can represent more serious problems in your 60s and beyond. The progression from early signs to serious complications can happen faster than you expect. A small polyp that causes occasional bleeding can grow and become cancerous within a few years. Chronic inflammation that starts as mild discomfort can lead to severe complications like perforation or obstruction. The key is recognizing that these symptoms aren't just part of getting older. They're your colon's way of telling you something needs attention. Don't try to diagnose yourself or wait for symptoms to get worse before seeking help. If you're experiencing any combination of these signs, especially if they've persisted for more than a few weeks, schedule an appointment with your doctor. Here's what to tell your healthcare provider. Describe exactly what you've noticed, when it started, and how it's changed over time. Don't minimize your symptoms or assume they're not important enough to mention. Ask specifically about colon cancer screening if you're due, and request blood tests to check for anemia if you're feeling unusually tired. Remember, catching colon problems early can mean the difference between a simple outpatient procedure and major surgery. Your colon health directly impacts your energy, your comfort, and your quality of life. These warning signs exist for a reason. Don't ignore what your body is trying to tell you. But here's something most people don't realize. When your colon is in trouble, it puts enormous stress on your liver. Your liver has to work overtime trying to filter toxins that your compromised colon can't eliminate properly. This creates a dangerous cascade effect that can silently destroy your health. That's why you need to watch my next video immediately. Your liver gives off its own set of warning signs that 90% of people over 60 completely miss. Signs that could save your life if you recognize them early. Don't wait until it's too late. Click the video appearing on your screen right now to discover the 10 alarming signs your liver is not working properly. Your future health depends on knowing these critical warning signs.